It's all local. It's all live. This is the Sharp Health Hour with Jerry Graff. You can reach Jerry by calling 1-800-760-KFMB, star or pound 760 on your cell phone. 760 KFMB, San Diego's talk station.
Good morning. This is Jerry Graff, and this is the Health Hour sponsored by Sharp Healthcare. We call it the Sharp Health Hour on 760 KFMB. If you want to ask any questions of me or my guests, give us a call, 800-760-KFMB. That's 760-5362, pound or star 760 if you have a cell phone. And now for AT&T customers, pound AM 760 will get you through for a free call. Today our topic is eating disorders. I have three guests in the studio this morning. We're going to let them tell you all about themselves. We have Dr. Thomas Hessling, Dr. Elise Curry, and Cynthia French. And we're going to talk about eating disorders. If you are not an eating disorder patient, don't turn the dial, because you may learn a lot today about how to watch out for eating disorders in your children, your grandchildren, anybody else who's a close personal association for you. So let's get started. Dr. Hessling, you're a physician, and you want to give us a little bit of a background, how you got into this particular field and what you do currently.
Yes, I'm a psychiatrist here in San Diego and work at Sharp Mesa Vista Hospital. I've been a psychiatrist for about 21 years. Back in the 80s, what I saw was a great need here in San Diego to specifically focus on treating eating disorders. There weren't many places available to get help. There was a great deal of national attention being paid to eating disorders at that time. And I started to spend a great deal of time studying it and treating patients in that field. Sharp Mesa Vista has a eating disorder program now since last February, and I've been in a position as their clinical director overseeing the program now for the last year. In addition, I have a private practice here and treat patients in my office in addition to the hospital work.
Okay, and Dr. Curry?
Yes, I'm the program coordinator for the Sharp Eating Disorder Program, and my experience with eating disorders started back in about 1989 when I met Dr. Gene Rubel, the president of ANRED, and this was back in Eugene, Oregon. And I worked with Gene from 89 to 91, working with bulimic patients and getting trained by her, and she's a master trainer, so I feel very fortunate. Then I didn't do a lot of eating disorder work because insurance companies weren't paying for it for about 10 years until the parity law just came, January 1st in California, where they're starting to cover eating disorders just as any medical condition.
And people need to know that, because I'm sure there are probably lots of people who still think that they're not covered, and so they don't seek help.
Right.
Cynthia,
yes.
How are you this morning?
I'm great, thank you.
Now, you're a recovered eating disorders patient?
Yes, I am.
And what else do you do?
Well, I am actually a singer. I'm a professional singer, songwriter, and also own a music publishing company that's in Nashville, Tennessee.
In Nashville, Tennessee.
That's
so does that mean it's country western music?
Predominantly.
Mm-hmm.
But, that's a very wide marketplace now.
Now, I understand you've been a backup singer for lots of big names,
yes,
including Reba McEntire.
I've had the honor of singing on her albums as well as a number of other country artists and pop and rock and roll artists.
And you wrote a book, which you'll give a copy away later in the program?
Absolutely. It's entitled Humanville, and it is a fictional book. It's a novel that is loosely based on my story, but it is about recovering from anorexia and bulimia.
Oh, great. All right, why don't we start out by defining the different eating disorders? And there are a lot of people who have eating disorders, but they don't really understand that they, in fact, have an eating disorder. So we have anorexia, bulimia, compulsive overeating, right?
Yes.
Basically.
Let me start with anorexia. Anorexia, the term is actually a misnomer, since the severe weight loss of the illness is not really due to a loss of appetite, but instead it represents a refusal to eat, a fear of gaining weight, and a significant disturbance of body image. The result is a body weight below what's normally expected for age and height for that person. And this is usually defined below 85% of their normally expected height and weight. There are two types of anorexia nervosa. There's a restricting type, which is basically where the patient really has a refusal to eat. And there's a binge eating, purging type of anorexia, where the patient may engage in binge episodes, but follow that by purging, and as a result of this, has this below what's expected body weight.
Now, anorexia patients, they often use things like compulsive exercise, laxatives, all kinds of things to keep their weight down to what they think it should be.
Exactly. They either restrict, or maybe if they're going to use these other behaviors, 80% of them engage in vomiting, self-induced vomiting. It gets to the point where they can almost vomit at will. And then there are those who do excessive exercising, abdominal crunches, running for up to several hours a day. And then there are those who, maybe about 30%, who abuse laxatives and diet pills.
Now, most patients are male, female, ages. What's the statistics?
It's predominantly a disorder that's found in women, but what we are seeing more and more is it's now becoming more common in males. But it's always long time been considered a disorder of women. It usually starts in early adolescence or early adulthood. I think even now in the population, maybe 1 out of 5 college female engages in some sort of eating disordered behavior. They may not have the full syndrome, but they do engage either in restricting or purging behavior.
Mm-hmm.
It's also interesting that the diet industry is now targeting males. They have a $50 billion industry that's targeted females mostly, but now they figured out they have another 50% of the population they can go after. And if they feel bad about their bodies, they'll buy diet products and develop eating disorders as well.
Mm-hmm. Now, Cynthia, you were anorexic in the beginning. How old were you when that started?
I was 15.
You were 15?
Mm-hmm.
And what did you, I mean, if you look back on it now, how did you view those years?
Well, my eating disorder pattern started when I was 8. I was using food at that point in my life to be a pacifier and to hide behind, I guess, when anything upset me. And at 15, I got involved in varsity sports and for the first time really started an exercise regime that pushed me to limits that I'd never been pushed to before. And I had a coach that suggested I lose some weight to become a little quicker on the court. And
were you overweight at the time?
No, no, I wasn't, but I thought I was. And so I took it upon myself to reach the goal of losing 10 pounds. And when I started actually succeeding in that, the sense of power and control that came from that victory of those 10 pounds, I decided to keep going to see just how low I could get.
And how low did you get?
At my lowest, I was about 90 pounds.
How tall are you?
5'6".
5'6" and 90 pounds.
Mm-hmm.
Actually, you've probably seen patients, right? Doctors
sure that
Curry and Hessling
thinner,
that were even thinner and lighter.
Oh,
absolutely,
yes.
Yeah.
I mean that's pretty significant. Again, we're looking at people below 85% of their normal body weight.
Mm-hmm.
Mm-hmm. Now, is her story typical?
Very typical.
Mm-hmm.
Now, are there characteristics of anorexia patients, like she said, overachievers? They have things like athletics come into play where they need to lose weight. They're pushed by a coach or maybe a family member to lose weight. Are these some of the things that sort of maybe trigger it off in the beginning in some people?
Eating disorder, even though we talk about it in terms of eating behavior, it's a psychological condition, that there are many psychological factors that go into the eating disorder. Certainly the strive for perfection, the sort of ritualistic behavior that one engages in, the need to be the good child. Go ahead.
Well, I was just going to interject and say that I think one of the biggest things in my life that caused that desire to become anorexic, well, I didn't realize I was becoming anorexic, but I felt a sense of control, and I didn't really have a sense of that in any other aspect of my life.
And that's also something that a lot of the patients express, that it gave them control over something in their lives.
Yeah, the other thing they talk about is anxiety, and especially with bulimics, if they binge and purge, they actually feel less anxious, and they don't have other coping skills in order to help them reduce anxiety. So it works.
Mm-hmm. Oh, my goodness. I was bulimic for 13 years after the 7 years of anorexia, and bulimia was something that not only could I be somewhat normal, but in binging, I buried a problem or a pain and could focus on the binging as opposed to focus on the worry and the anxiety. And then in the purging process, it was a way to not only get rid of the food and feel that sense of control and power over not having a weight gain, but also I purged the problem.